Welcome to the Unapologetic Midlife Podcast. I'm your host, Mindi Lobuzzetta, and I am here today with Dr. Laura Mango, MD, who is an internal medicine doctor working at Roswell Park Comprehensive Cancer Center. Welcome, Dr. Mango.
Thank you. Thanks for having me.
Thank you for joining us. So, like with all guests, we just kind of dive in. I don't know if people know that this is never scripted. We just dive in. Let's have
Okay.
at it.
Let's see where we go. Let's have some fun.
So let's kind of talk about this. So you're a medical doctor, and I know also that you've been very open about your breast cancer journey, but let's talk about your history of becoming a doctor. What did that look like, and how did you end up at Roswell Park Comprehensive Cancer Institute?
I'll
You're good.
start with I went to medical school in 2005. So that will age me and date me.
It's okay. This is midlife,
I
unapologetic
am
midlife podcast.
unapologetically midlife. Let's just put it that
Perfect.
way. I am midlife. So roughly 2005, I went to medical school. Not something that people know about me. You have to take a medical school entrance exam called an MCAT. I don't know what
Okay.
it is now. And I was having it's not like a pass or fail, it's just a number. And I was
Yep.
having some difficulty. So the first time I sat for it, my number wasn't great. And I was having trouble getting into medical school. And I was like, I'm not giving up. So I took
Okay.
a Kaplan review course. And when you apply to medical schools, it takes over a year. It's about a year and a half. So I ended up not really getting any traction, or my application didn't seem to want anybody to interview me for medical school. So I sat with it. I knew this was my purpose and my passion, and this is what I
Yeah.
was meant to do. And so I took my MCAT a second time, and I got a better score.
Good.
But because of like being well, it was 2005. So being almost 25, that's late to go to medical school.
Which is crazy because obviously now we know it's young, but
Right. Yeah.
in medical
So
school terms, okay.
right. I don't know. I mean, my GPA was good. I had all the, so to speak, highlights on my application, but I was having trouble getting into a school. I ended up in a Caribbean medical school. I wanted an
Okay.
MD.
Okay.
There's DO schools. One of them where I had to travel. I don't know. The idea of going to Ross University is where I ended up in the Caribbean.
Mhm.
It was an MD degree, but you do 2
Mhm.
years offshore, and then you come back for your clinicals in the 3rd and 4th year, and they rotate you through different hospital systems.
Okay.
So not a traditional medical school where you're in the same place for 4 years. You go to the Caribbean. Sounds nice, but it was a little tiny island called Dominica, and it was not the crystal clear beaches that you think of.
Okay.
Yeah, it was it was it was rough. We won't get
Yeah,
into
I
it
was
'cause
gonna
that's a
say
whole
that's an
nother.
adjustment. Yes.
I joke it's like med school Survivor.
Okay.
So I
Okay.
the things that happened down there helped toughen me up, let's say. So I ended
Yeah,
up
shaped
coming
you.
back. Yeah, so I ended up coming back and doing my rotations all in different cities. So I lived in Miami, I lived in Chicago, Cleveland, and in New York.
Okay.
And I was able to find my way back to Buffalo and got my residency here.
Oh, good.
Yeah, yeah. So I did internal medicine, and that's how I ended up in internal medicine. My goal was always to take over my father's practice. He was an internist
Mhm.
here in Buffalo, New York since the
Mhm.
70s. And when I graduated residency, which was about 2012, I went to work with him part time. It was a
Mhm.
primary care practice. So I had my
Mhm.
own private practice. I had my own part time subset of patients that were belonged to me.
Mhm.
And then I also worked at Kaleida in the basically a step down ICU. And I
Okay.
was doing that while trying to build the practice. In the meantime, fast forward, met my husband. I now have 5 kids.
You're busy.
and
Yes.
and
Busy
trying to
mom.
yeah, and then trying to juggle the step down ICU, they called it the ILCU at Buffalo General, and a private practice that I was traveling to Williamsville, and I live in Orchard Park. I ended up finding this role at Roswell Park in 2017. And interestingly enough, I was hired as a consultant. So I was
Okay.
hired by an outside group in 2017. And this is when Roswell was working on creating a clinic where their cancer patients could go that was in an emergency room, almost like a
Uh-huh.
sick care clinic, an acute care clinic, in a sense, an urgent care, but being it's urgent care for cancer patients, which is a whole different
Yeah, ball of
thing than
wax.
going
Yeah.
to a local urgent care. So I've been with Roswell since 2017. They officially brought me on as their medical director, then promoted me to the chief, division chief.
Congratulations.
And that was 2019 I was brought on, and I can't remember, a couple years ago, I was promoted to that role of division chief. So I've been helping grow this clinic inside Roswell Park
Yeah.
for nearly 10 years.
Wow. Yeah, I remember because my cancer was 2010 and that didn't exist. It was like, "Oh, call this hospital," and I remember I won't get into it, the horror story I went through having platelet transfusion the day before,
Mm.
going to the ER with no hair and a PICC line, and they're basically treating me like I'm a drug addict and I had a bowel obstruction. It was bad. I wished
Oh,
this existed back
you're making
then.
me get emotional. I'm so sorry you went
But
through
this
that.
is why I love, like, that you do this because, man, it does make me emotional because it was hard. People don't get what that's like to go through that. So to have an emergency room for these active cancer patients that are clearly struggling,
Right.
they walk in, they see someone like yourself or a doctor maybe you've trained, you're kind of running the show a little bit in that department, and these patients need a friendly face who understands cancer care is complex.
Correct. Yeah. So that's a little of our background. And for your viewers, that was, we kind of knew of each other. I don't think we were ever friends, but I remember I was on my rotation at Roswell and I
Mhm.
walked in the room and it was you. And
It
I was
was
like,
me.
I know you, don't I?
Yep,
Well, we
yep,
know of each other, and it's the
yep,
Buffalo connection where you grow up here and you know
yep.
people who know people who know people. And I remember feeling so grateful that at least for you, I felt like you relaxed a little bit
Yeah, like there's a friendly
went
face. Yep,
and
yep, familiar face.
a familiar face, and that was our connection. And then through the years, our friends are friends, and we all
Mhm.
gotten to
Cross
know each
paths.
other
Yeah,
and cross
yeah.
paths. So that's where our connection comes in. But yeah, so it was, it is not the easiest place to work. And
It's
it's,
hard.
yeah, it's not hard. It's not a true emergency room, right? So we can't accept ambulances. You have to come
Yep,
by a personal car.
yep,
And when we initially opened, we were only open 12 hours, 9 a.m. to 9 p.m. And then we eventually progressed to a 24/7. We are not
wow.
as busy at nights, but we are
Yep,
getting there, and it's a place for Roswell patients to land safely as long as they can get to our clinic safely. So we are working really hard in making sure that we're always there for them. And it is a way. I know everybody's going to have their stories or experiences, and
I get
I
it.
hope all our patients love us when they walk through the door, and does a good job, and I'm sure there's good and bad reviews, but I like to think we are do something that you can't get in an emergency room. We call you in. Unfortunately, you have to wait at home, so we got to make sure it's safe. Once you're there, you're pretty much roomed right away. We can get an IV or port, and we start going. So
Yeah.
within, it's very rarely people have to sit in our waiting room unless there's a couple emergencies happening on campus that kind of supersede what's happening or was unpredictable, but we tried to create an environment where our cancer patients can come and just feel like they're completely cared for. And
Yep,
then being though I'm not an oncologist, I can then reach out to their cancer care team. So I'm
yep.
on campus, I have access to their records. I can do
You're the bridge.
more than an emergency room, and I may or may not have to do as much work as an emergency room to get the same answers, if that makes sense.
Yeah, yeah, and having access to the hospital, having connection to the doctors,
Yes.
maybe are overseeing depending because there's so many different departments and stuff there.
Mm.
It's crazy. You work in a very specialized field, even though it's also broken down into whether it's skin or breast or blood. I mean, hematology, it breaks down into so many different things. I often, and I, I never want to like offend anybody, but I'm not your average patient when I walk into a doctor's office. Now, I've done my research and I've lived a lot of things that I can kind of run circles sometimes around some. But like, if
Really?
I'm going into primary care, like I know things that I've had, that cancer and stuff. It's crazy. Like you start to gain some experience that you didn't ask for, but it definitely gives you some perspective.
Right. Yeah. So for me, it's always listening to the patient. And a lot of times, I've gained over the past 20 so years in clinical medicine is that I never discount anything a patient's telling me. And that comes with experience and clinical years, right? You can't really
Yep.
teach, you can teach it, but really that's the most important thing for me is if I have somebody who's coming in and telling me
This is
this
a
is
problem.
something's going on. I know my body. I'm gonna do everything I can before they walk out of our clinic to say I've either determined something more urgent's going on. We're going to admit you to Roswell Park, or this is something we can manage as an outpatient and then coordinate care for them with their oncologist. So in a
Yeah.
lot of
And
ways,
that's
I'm the middleman doctor.
But that's huge though. I think we need that. I think that's something when I was there, like I said, it lacked. And
Yeah.
it's very scary because I mean, I'm not going to go down through the horror list,
No.
but definitely things that were hindsight like, oh my God, this is
Right.
scary. So I think to have that middleman, because when you're going through cancer too, these patients are stuck in flight or fight, they're surviving, and they are going to be like, oh my God, is it the sore throat coming back, or is it this or it's that led to whatever it is that they're dealing with. So you being able to be that connection, it's huge. Like your job, I just don't even think you could put a price tag on
Thank you.
how
Thank you.
important it is.
No,
You're
I
welcome.
appreciate that. I think and not only that, but our clinic is fantastic from the secretary that checks you in to
Mhm.
they call them PCTs, who room you, and our nurse practitioners and PAs and our
Mhm.
nurses and managers, and just the whole clinic itself operates completely, oh, I wouldn't say different, but it just doesn't operate like a normal outpatient clinic because of the
Correct.
nature and the acuity of patients walking in the door. So I appreciate that we've given Roswell's cancer patients somewhere to go. And that means a lot to me. I think it gives me a lot of purpose and passion for what I'm doing, even though some days can be really hard.
Yeah, yeah. I mean, it's you're trying to make a really difficult moment in a person's life or period of a person's life a little gentler by being supportive, by listening, by advocating, right? Like
Right.
that, so
Absolutely.
necessary. Yeah. So now this ties into your own journey, right?
I should have had a box of tissues next to me.
You can grab
I am
one.
not, but I mean, it is emotional and it's okay.
Okay.
But
Yeah.
yeah, so I was diagnosed with breast cancer. It still gives me every time I say it.
It's okay.
In September of 2024. That
Okay.
was definitely not in my plans
It
at
was not on the bingo card.
well, and when I was 44 at the time, and so I had pretty much in the midst of running a household, family, sports, going here, there, and every other way. And yeah, that's the moment that my life kind of changed. Your life changes in all different moments throughout
Oh
it, but
yeah.
that was a pretty big one for me. And
Yeah.
I went from being the doctor treating cancer patients to the cancer patient myself. So it was a interesting situation to find myself in, and one that was very tough. You've heard those words, you've been in those shoes, so I know
Yep.
it's easy for you to understand.
Yeah, like nothing prepares you for it, and I don't know what your family history is like, but mine there wasn't any to my knowledge at the time.
Right.
And so I was the first one kind of paving the way. I had no experience with cancer. I mean, leukemia was my second one that year, so I had experience in other ways, but leukemia is a whole different ball of wax than just the surgery for the hysterectomy and obviously the sepsis. But and then I learned at 40, my dad who raised me wasn't my biological dad, and I had a whole dynamic of family history of cancer that
Wow.
was like, okay, so this is starting to make sense now.
Yeah. No family history of cancer in my immediate family. Um,
Yeah.
I'm the youngest of 4. I have 2 sisters. My mother passed away young at 69, but she didn't have any breast cancer or any cancer diagnosis. So it was, I was the 1 in 8. I became one of those women who who gets breast cancer? And then you
Yeah.
start to dissect everything you've done in
Of
life
course.
about why did this happen to me, and you try not to be like, oh, I'm so unlucky. And I don't know, for me, I knew something was wrong. I had a
Mhm.
feeling something was wrong. I mean, just listening to my body, and knowing that something didn't seem right. And
Yep.
when I really look back on it, I mean, it proceeded for a few months.
Mhm.
So being that I am a physician. I try to practice what I preach. I started
Mhm.
giving my mammograms when you're supposed to start getting mammograms,
Mhm.
right before I turned 40, so I was technically 39. And of course, I was like, I work at Roswell Park. Why wouldn't I get my mammograms here? So
Mhm.
of course, I did it there, and I was doing it every year. In 2023, they actually called me back, and to give a little background to people, I had my younger three children. I have five children total or blended. My younger three children I had pretty consecutively.
Mhm.
And so finally I lost quite a bit of like excess weight that'd been hanging
Mhm.
around for a
Mhm.
while. And so
Mhm.
2023 they called me back and they're like, well, you have very dense breasts, but it's just we thought we saw a shadow. They called me back for a diagnostic. It was clear. And that was in December of 23. And by August of 24, I called my GYN, who, being in the medical world, these people become your
They call the
physicians, become
scripts
your
in.
friends or you trained with.
Yep.
And so
Yep.
I call everyone my buddy. So I called my buddy, who's actually my OBGYN who delivered all my children. And I said, listen, I really want to get my mammogram. I think something's wrong. So
Mhm.
you got to come see me. I can't just order it. It's early. So I
Yeah.
went and saw him, and what I was feeling, he said, it doesn't feel like it, but I can see that, this could be
Your
something. So
concern, yeah.
that's concerned. So let's get it. And lo and behold, the little area I was feeling, this kind of like nodule area, was not the cancer. It
That
was
was just a cyst, and
it
then
was just like a fibroadenoma. It was just, and that's why I kept thinking. But my symptom that I was having was I was getting very tender breasts, almost like I was breastfeeding again.
okay.
And being that we're all women, and not, I'm not completely
44.
symmetrical. Yeah,
Okay, okay.
I'm not
44
completely.
too, though.
Yeah, so
Hormonal shifts.
my right was always a little smaller, and I remember at one point was it kept getting sore and heavy, and it just didn't feel right. And I remember putting my hands up in the mirror, and I'm looking at myself,
Right, you're checking, yeah,
and
doing
I'm
all the
like,
things.
"Does it look the same size?" I called my
Yeah,
husband in, and
right.
I'm like, "They've never been the same." I'm sorry, I'm giving a lot of
Nope, you're good.
information.
You're
I'm
totally
gonna
good.
and someone sees me and tells me that, I'll be like, "Yep, it's true." So that's it, and it was that, and it was the swelling and the pain. Retrospectively, my husband was like, "Yeah, I kept seeing you do this. Like, I'd always be
He
doing
knew,
that,
yeah.
like, rubbing it," and I was taking all this Motrin, and I'm like, "Oh, I'm midlife. It's
Yeah, these are the
very normal.
changes. This is
This is
normal. Yeah.
this is
Yeah.
normal. This is the changes." So I could see why anybody would write it off. You wouldn't think that that was cancer, but now that I look back, I'm so happy that I listened to myself, or you feel like these angels look out for you, and I was like, you have to go do
Yep.
this. It was like
Yep.
that little voice in your head. I
Don't
sometimes
ignore
say it's
this.
my mom who had passed on, and I was like, you
Mhm.
have to go do this. You have to do
Yep.
this. And when they did my mammogram, hopefully I had previous mammograms for them to compare it to. And when they looked, they saw these very tiny calcifications that looked like little sprinkles of salt. I mean, when I talk, say
Didn't even look like a tumor. Right. Yeah.
millimeters. Because of the mammary gland, like the ducts, when it's in the ducts, it's almost like a tree.
Okay.
It takes on the shape of the duct. So when
Okay.
it's still in the ducts, early stage cancer, it doesn't necessarily always become a mass.
Yeah. So you had
It's like
ductal your
yeah. So I had DCIS, so
okay.
ductal carcinoma in situ. They
Okay.
call it stage 0, which really messes with you, but I was like, "Stage 0?
Yeah.
So do I
What does
have
that mean?
cancer?"
Yeah.
They're like, "Oh, no, we're cancer cells." And I'm like, "Well, why do we call it stage 0? Shouldn't that be the first stage?"
One. Yeah, 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 yeah.
I don't write the rules. I'm not an oncologist, and I was like, "This is really messing with me." And so, you almost feel like you're overreacting, but they're like, "No, you have cancer." And I remember the day I got the kids went to school. It was September 4th. I went and got the mammogram. I ended up being gone all day. I
Because
called
they
my
didn't give you the results right away.
well,
They
no, I
called you.
had to get the second mammogram when they did the diagnostic the same day.
Okay.
Because they
Yeah.
added me on, it was like I said, "I'll wait. I don't wanna come
Mhm.
back. If you can
Yeah.
fill me in later, I'll just, like, go get lunch." So I ended up
Yeah.
doing the diagnostic later that day, and she's like, "We can biopsy the one area." So I was like but she's like, "The small calcifications need a stereotactic biopsy. We have to do that next week." So they did that ultrasound biopsy the same day, and that was the mass I was feeling, and that was negative. I knew that. And then I went back the following Wednesday, the 11th, for the second biopsy,
Mm.
and I learned then I should stop going to these things alone, right? Because you
Yeah.
walk in the room and it's very
Your brain
daunting.
shuts off. Yep.
I saw the machine I had to climb in to get the stereotactic biopsy, and I thought to myself, like, that's when I was oddly calm, but I was like, "Holy crap."
Like, this
Like,
is real.
I'm
Yeah.
really in like, I am the patient. This is what you walk in and see. I have medical background, and it's still unnerved me to be wow, I mean, you're laying face
Yeah.
down. It's a fantastic technology. It's like GPS. It's unbelievable what they
Wow.
can do.
Wow.
So, yeah, so I got the second biopsy, and I hadn't heard as quickly as the first.
So the nerves, right? Everything's building. I'm waiting, right?
Yeah,
Yeah.
so by
Yeah.
that Friday, it was the Friday the 13th, I remember September 13th, and of course, being that I work there and I have, administrative duties and leadership roles, I'm in meetings with the chairs and chiefs of these departments, so, again, they've become, like,
Friends. Yeah.
friends to
Colleagues.
me.
Yeah.
So I reached out to the head of, breast radiology, the chair of the department, and I was like, I'm anticipating this result." She goes, "Trust me." So when she called me, I knew. I was driving, so I advised,
Don't be
don't
driving. Pull
pull
over. Yeah.
over."
Yeah.
That
Yeah.
was it. Whenever I relive that moment, it just
It's hard.
yeah, it's
Yeah.
hard. Take a big exhale, and I think where I've come now, but that moment is just you know nothing. Your
Yeah.
world is upended,
Yeah.
and you don't know where you're gonna be this Christmas, next Christmas, this birthday, and the first thing you think about are I mean, for me, was my
Your
kids.
kids.
Yeah.
Yeah.
I mean, when
Yeah.
you're at such a young age, I know it's different, but either way, you think of your family or something really important to you, whatever that is.
Yeah. Yeah. No, I think as a mom, I've been fortunate to be in remission since, my kids have come around. The fear is always there, right? I know I'm
Mhm.
not diagnosed again and I hope never to be, but also I got kids and at this point I've got a partner. It's not just me out there surviving. It's like there's people who depend on me.
Absolutely.
And, you have 5 kids, so yours is double mine even.
Yeah,
I know the 2 older ones are older, but
yeah,
you
yeah,
have your
yeah,
life looks different.
yeah. So it
And
looks different, and
yeah.
so that was it. So that's the moment everything changed for me. And it's not that it was a secret. I was sharing. I think plenty of people knew. I know after my mastectomy, my Kristen, my cousin that coordinated along with I think my sisters with, like, a food meal train. And
Mhm.
normally, I was always the type of person that says, "No, I don't need help. I'm super tough. I do everything on my own. I went to med school in the Caribbean. I traveled all over the country. I never needed help. I once tried to install my own air conditioner." I don't
You
need help. Yeah, but
yeah.
I learned was as much as I was outgoing and had friends, it was also a self-defense mechanism and was
Yep,
also a way to keep people out. So
yep,
learning to accept I need help and that it's
yep,
okay to be like, I'm not perfect and I can't do everything
yep,
was a big moment for me. So that was and maybe for you too, when you were diagnosed with cancer, there's these glimmers, I call
mhm,
them, and
yep,
I think some people have written about this as well, where you're going through something very horrible and terrible, and you see the side of humanity that you don't always see. So
yep,
I call them angels who come from anywhere.
yep,
So strangers, my coworkers, my family, my colleagues, my friends,
yep,
maybe people I didn't even know that well, once they heard immediately called or reached
stepping up.
stepped up,
Yep.
and it was in a way, I try to use that to say, well, here's this really bad thing that happened to me. Here's all these really good things. And I think I've gotten really good at that since cancer, where I can say, even though things may not be the way I want them, I can see the good out of
The good
all.
stuff sprinkled in there.
Right.
Yeah. I think it restores, like, your faith in humanity a little bit sometimes
Right.
with so much, not to be political or anything, but there's always something kinda going on in the world, and, it just sometimes feels really heavy, and then going through something like this, people stepping up and people being supportive, people coming out of the woodwork, and they don't have to do any of these things. There's nothing they're gaining by
Right.
bringing you a meal or stopping by or just simply reaching out to you and checking in. It it really is what helps to get you through it. I remember waking up and I'd wake up and my room would be, like, full of people. There was always people visiting. Sometimes I'd be so exhausted that I couldn't even keep my eyeballs awake, but, like, to feel the love and, like, people will say, like, "What got you through this?" And, I wasn't married at the time, didn't have kids, my family didn't live here, and I'm like, "It really was, like, my friends and the people." Like, it just gives you hope that you're gonna get through this, and it's maybe those moments of laughter or the friends who bring, "All right, we're having a movie night," or the
Like the
flowers. Yeah.
time when walking around the block with my neighbor, it was just
Yeah.
all these really small, wonderful moments. And so it's not that I wasn't sharing it publicly. I needed to do what I needed to do.
Yeah.
Right. Like I was
Yeah.
like, I
Yep.
almost took it on as like a job, which is just so
Well
me. Right. I'm just like,
but also, like, it's I gotta do what I gotta do, right? Like,
so,
that's just a part of it.
so
There's no
I,
script for how to do this
yeah.
perfectly. It's what you gotta do.
I hit the ground running. I mean, obviously, there was a lot of really bad days in there, and I had a wonderful support system. A lot of people have told me I seemed like I had it together, which is shocking to me because I felt like I was a total mess. But that just goes to show you that what you're doing on the outside doesn't always match what's going on the inside. And so that was it. So as soon as I found out, I was like, I want this out of me as soon as possible because in my head, I was like, last year it was not even a year ago, 9 months ago, it wasn't there. And I'm like, "It's
Yeah.
here now," which tells
Yeah.
me in my head, I was like
Evict
I was like, in my head,
Yeah.
it was aggressive. So then comes the decisions for breast cancer patients, and this is, I think, until you get a plan for your treatment, and I think that's true for any illness, not just cancer, but once you understand a plan and you have a plan of care, it gets a little easier, but it was like I just needed to figure out how to get this out of me as soon as possible,
Yep.
as safe as possible, in the best hands as possible,
Yep.
and that was it, and I forever grateful that I don't think it's an accident I ended up working at Roswell Park. I don't think all these life
Think so
events
either.
brought me to where I am, and here I am. I get diagnosed with breast cancer, whereas, I can't even entertain what would have happened if any of my decisions didn't lead me to this point. So that's
Yeah.
how I know I'm exactly where I'm supposed to be. And I'm forever grateful for Roswell's breast radiologist. Their expertise and the ability to see what they saw. And then I also
Mhm.
think, what if I, waited, right? And that's why I
Yeah.
now, after going through my surgery and surgeries because it's more than one.
Multiple, right?
After going
Yeah.
through my multiple surgeries and kinda sitting with that and coming up on the year mark this past October of, 2025, that's when I was like, "I need to make this bigger than me. This has to be bigger than me. I have to tell my story or encourage, motivate other women to start doing their mammograms earlier. Not only that,
Yes.
but to know your risk factors and get it sooner than 40 if you meet certain risk factors." And I was compelled to share. I felt like it was selfish if I didn't. Being that I am a physician, I work at a cancer center, and now here I am standing on the other side of it. Maybe if my story didn't end up so good, would I have shared? I think so. I just think I needed to get to the right mental space.
Yeah, and I think sometimes that just takes a little bit of time. I mean, a lot of things weren't around. I mean, yes, there was Facebook and Instagram when I was sick, and I did share some of my story, but it's a little bit different. And, you having a very, I don't want to say a public profile, but like you're being in the hospital, you come across a lot of other patients going through this or starting this journey.
Right.
I think too, seeing somebody and having a really good experience gives people hope. And I think when you're diagnosed with cancer, like mindset is everything. mindset is everything. And some days are going to suck. Some days you're not going to feel like you got the greatest mindset.
Right, I know. I I remember the day my path report, I was finally waiting for my path report. Like, we knew it was cancer, but I was waiting for, like, the hormones and the HER2, and was it still in the ducts? Was it really DCIS? Was it not? And I just remember,
Hmm.
like, the initial, like, core biopsy, the stereotactic biopsy was reading triple negative, and I was just
And
so
that's estrogen, or is that estrogen and
negative,
positive
all
or
negative, estrogen,
all negative?
progesterone,
Okay.
so, with DCIS, they don't always necessarily check the HER2, I think. It just once they
Okay.
do the final pathology, but I just remember thinking, like, it's the worst case scenario in my head, right? Because it's the most aggressive.
Right.
That led me to my mastectomy. Initially, they thought the area was small, and then I got the breast MRI, which said it was meters,
It had
not
branched
millimeters.
out a little bit.
Yeah, it was almost 4 centimeters.
Okay. Yeah, that's a
Yeah,
good size. And I feel
yeah.
like you want best
3 and a
outcomes.
half or something, yeah, 3.5 to 4, and then they saw a second spot. The left breast was clear, the right breast, they saw a second spot, they wanted to do an MRI biopsy, and that would have delayed. I said, "Nope,
Just
we're
take it.
doing."
Yeah.
And then I started doing my research and talking to breast surgeons, breast radiologists, oncologists, you name it. I leaned into anybody who could help me, and I talked to a lot of people or surgeons in the area, some experts, and I said, "I'm doing the mastectomy," and that's it.
Yeah. And that's going to give you the best outcomes, right? Because now I'm eliminating,
Right, especially for
like,
DCIS.
okay.
I know they have some good. I can speak on mine.
Hmm.
So with DCIS stage 0, and my
Hmm.
final pathology did confirm that it was all DCIS.
Okay.
The lymph nodes were negative, the
Good.
margins were clear. They did
Good.
find a second cancer though. Many people don't know that it's something called Paget, which is a different cancer of the breast, which also was in there somewhere, hiding, couple somewhere in there. I was like, so I remember
Of
when
course.
I sat down with my breast surgeon because initially he's like, "I want you to feel comfortable." I was like, "With that size, even if you do the lumpectomy, I don't." And it's not that I dislike radiation. I just, for some reason, was like, if I cannot have radiation
Uh-huh.
to this side of my chest wall, that was part
That's
of.
what you wanted. Yeah.
It's what I wanted. It's not the right decision for everybody, and some people can go with a lumpectomy
And
and
they're fine.
lymph
Yeah.
node biopsy, and there's even new data out there now that if it's depending on the size and the stage, they may not even need to do radiation anymore.
Oh, wow.
There's some new randomized control trials that came out about that. So it was just for me, it was mastectomy or nothing. And that took my so when I talked to the surgeons that I talked to, it took my risk of recurrence from, I think they said 7 or 8% to 2%. And
Okay.
even though that's
Which
92, 93, 94 to
let's
98
just,
or
yep.
90, I
Yep.
was like, "That I will be the one. It will
Yep.
come back." I was
That's
like, "Take it."
That's how I felt with my hysterectomy. Some people disagreed with me. You're young, blah, blah, blah. And then when I had the leukemia, for me, I'm just like, see, clearly I didn't win the genetic lottery. Hey, something is going on here. And I'm glad, I did it the way I did it. And then, I adopted my boys. It all worked out in a crazy way. I don't want to go through it again, how it was
No,
supposed to. It's kind of crazy to think about that, but I do, you know?
you can't help it. It's
You
just
can't
nat
help it.
You can't help
Yeah.
it. It's just natural to think about what happened. So, I just had my first MRI, breast
Okay.
MRI since everything.
Yep.
And being that I've shared my story and I was going in for the MRI and I did it at like 5 o'clock because I worked in clinic that day. And so it was like
Okay.
a little after 5. So it's not nearly as busy. And
Yep.
it was just the way it was scheduled. And there was
Yep.
somebody checking in and he looked at me, he goes, you're the doctor from the commercial. I was like, yeah, it's time for my,
Oh.
gives me a high five. He high
Oh.
and I'm like, that is part of it. Like, right? If I never shared my story, that kind of support that you get that you
Mhm.
didn't even expect. And I thought,
Yeah.
here I am, a total wreck. I worked in clinic all day taking care of really sick
Yeah.
patients. And here I am going for my MRI. It's just such a contrast of, okay, hanging the stethoscope. Now let me go. So I go in, and even with the nurses, they're very nice with me. I'm like, just treat
Mhm.
me like patient Laura. I don't treat
Mhm.
Doctor Laura.
Yep.
just let me be a patient here today.
Yep.
And they were very sweet and good, and just everything was very professional. I got my MRI. My son's birthday was Sunday. He turned 8.
Oh, yep. I did see that.
And
Happy
my
birthday.
MRI was Friday at 5. So I was like, "Oh, are they gonna read it over the weekend?" Which I assume they were gonna, so they can catch up before Monday.
Mhm.
And so all day Sunday, I wouldn't look.
I don't blame you. Just let's stay focused
Because
on his
I
birthday and
thought, if I look and I know I can't enjoy this day with him. And
mhm.
I waited and I waited, and at night I asked my husband, I'm like, "I gotta check the portal. Are you ready?" Because now he knows.
Right, right, yeah, because he's yeah.
I'll do some things, like I went for the MRI alone. There no one can come back there with you. So either way, there's certain things you just have to do on your own.
Yep.
And so we looked, and I got the clear on Sunday night that right now
Yay.
there's
In
no
remission,
evidence of.
no active cancer.
Yeah,
Yep.
yeah, my mastectomy side, or because my left is now reconstructed, so I still have real breast tissue there.
Okay. Yep, one reconstructed and one natural.
So
Okay.
I still have a risk. Theoretically, my risk of getting cancer in the left breast would be random, but
Okay.
double the normal population because I've had breast cancer. So now, even if I get cancer in the left, it's no relation to the right. It's just
Yeah.
my risk goes up because I've had cancer.
Now, here's something to ask, and I know more and more research is coming out. You were 44 when you were diagnosed. It's funny because going down this fun perimenopausal journey, I'll be what, 48 next month. They say there's like 2 points that we kind of age. And I never knew that. This is like research of my own I found, but they say 44 and like 60, like we tend to like age more. What are your thoughts on the irony of you being in perimenopause and here this is? What are your thoughts on that as a medical doctor?
One, I now the more I know, the more I see the younger and younger women
Mhm.
getting diagnosed, even under 40, right? Under
Okay.
35. So I think that it's on the rise. I'd have to check my facts, so don't quote me.
Yeah,
I won't
yeah,
give a percentage, but it's definitely on the rise in younger women. I know we're living longer, breast cancer patients as a whole,
yeah.
because of treatments and everything. But for the most part, I do think that. But I think I just I I
There's so
try
much
not.
they don't know,
Yeah, I
right?
try not to overthink it. I never knew that, like, I mean, I certainly felt like I had aged at 40.
I'm like, "What are these jowls at 40?" I that's when I started to really notice, like, the hair started falling out more,
Right.
just things I couldn't lose weight, like, now I have to work out, like, there's just things that I just felt like my body it was, like, almost like overnight, which kinda sounds crazy to say, but it was that 44 time
Yeah.
frame,
And it was
you
kind of
know?
building up to that, and I remember, I mean, because my son was born and I was 38, so I was still breastfeeding when I was 39. So,
Yeah,
and I really, after my 3 kids back to back, I got back to the gym because, again, I have to practice
yep,
what I preach, right?
yep,
I can't just say, "Oh, you need to work out and take care of yourself and eat healthy and get your colonoscopies and mammograms and all that stuff," without doing it myself.
yep,
So I was always in medical school. I found running and exercise. I was always an athlete. I played soccer. I played softball. But as far
awesome.
as taking my health very seriously, I mean, I was never a smoker. Of course, we grew up in Buffalo, so we all were
We all were
drinking in
drinking, yeah.
18 years. Um, but I never took it so seriously. But I remember right before I turned 40, something inside me clicked, and I was like, I need to
The
take
shift.
care of myself, now that I have all these kids. And I thought, if I stop taking care of myself, it's going to take that much more to get to where I am. So I'm just going to go. And that's what I did.
Mhm,
Jack was about a year old, and I
mhm,
just started working out. And now it's become, if I don't do it, I don't feel good. And that
yeah,
was the toughest part going through my surgeries, was
because you couldn't do a lot.
I
Yeah.
had to find new ways to exercise, walking. I mean, I had my mastectomy and I walked like 3 miles with like
You
5
know
days.
what, though? You probably just needed it, like, it was an outlet, it was what you can do
Right.
safely.
I mean, you should, I don't know if I should be telling people that, because I don't want patients to go out there exercising after their mastectomy. For me, I had to, I started walking, and I just said, this is all I can do. This is what I'm going to do. And so I
Mhm.
walked every day, twice a day. The little block around my house is not very
Yeah,
little. It's about a mile and a half. And I
okay.
would do it twice a day.
Yep.
And that
No,
was
I honestly think, I mean, even when I was inpatient in Roswell, and maybe I was neutropenic, they would say, "Okay, this is how many laps on the floor to get, a mile," right? And you'd be out there with your little
right.
tree and your bags, and I remember one time stubbing my toe on it. I don't know
Um,
what I was wearing for shoes, but clearly I wasn't, maybe I had the socks on. And I feel like walking is pretty safe as long as you're doing
yeah,
it.
I did that, and then I really have gotten into meditation. I've always journaled,
Mhm.
and I got away from it, so now I'm back to journaling all the time.
Yeah.
I can't underscore the importance of seeking therapy and just
Mhm.
helping yourself through these things because it's traumatic. I mean, that's it. And whatever it is,
Yeah.
any life event, not just having cancer, but grief or, just any an abusive relationship, a divorce, anything that could be creating
Stress in a
suffering
person's
or
life,
stress,
yeah,
suffering or
yeah.
stress. I think it's really important to acknowledge it. Yeah, meditating's been a joy for me. I love doing it. So that's a new thing for me that over the past few years that I log hours now doing.
Good for you,
I
because
mean minutes per day, but like hours over like the course of the year. Like
but
I
that's
mean
good though.
for myself.
Here you are, a doctor working probably full-time, I'm assuming.
Yeah.
You have
Yeah.
5 kids, and even the older ones still make their way back, I'm sure. So you, with 5 kids, married, full-time job, are finding ways to exercise and meditate. So all of you listening out there that wanna say, "I have no time," you have time.
You
You
have to
just have to
find the
make
time.
time.
You have to
Yes.
find the time. And
Yes.
I can't stress how important it is, I think, for anybody who wants to live a long, healthy life, that if you don't make time for yourself, even if I can't work out and I
Mhm.
go and I work out and it's 10 minutes and I run a mile, it's just
It's
it.
better than
That's
nothing.
10 minutes that I wouldn't have never worked out that day or exercised, or if I do my 5-minute meditation in the car right home.
Yep.
I mean, I'm not an expert. I'm not sitting there on a pillow silent with no one around me. Sometimes I'm sitting there drinking my coffee or washing the dishes and I'm
Yep.
listening to my meditation.
Yep. And you're just giving yourself a minute, focusing on your
Right.
breathing,
Just to
present in the moment. Yeah.
Yeah, and that's a lot of think I've always tried to live presently, and I think I've worked really hard at that over the years, being a
Mhm.
physician and seeing how people's lives can change in an instant, just through all my training and even in my own life with the
Mhm.
things that have happened in my family, and losing my mom suddenly. You don't take it for granted, but
Yep.
when this cancer thing happened to me, it's just everything shifted.
Your whole world is turned upside down. I feel like just the whole world as you once saw it. It's almost like, again, taking the blinders off, and now there's this big panoramic picture, and it's like all the little things that maybe might have bothered you previously suddenly are not even
Yeah.
relevant. And I don't know, maybe you embrace the hard moments being a mom of 5, right? Because I've definitely cried in the laundry room before, taking a moment to myself.
Mm, I know.
It's tough. It challenges us in ways, but also I look at them and I love them to pieces, right? So sometimes
Right.
it's, embracing the chaos a little bit, breathing through it, finding ways to just relax and downregulate that overstimulation a little bit, or finding moments to shift gears. And I think one of the biggest things, like you're saying, is that self-care component. And moms, I mean, we are busy. You are very busy, and you're still finding time.
Right. So that's you just have to find time and you have to if you don't do that, it will catch up with you in some way,
I
shape, or form.
agree. I
Mine
agree.
was my cancer diagnosis. Whatever it is in any way, eventually I think everybody will have that moment. Now what they do after that moment is up to them. But once you get that moment, for me, I wasn't going to sit here and feel sorry for myself. It makes me want to say, "Oh, well, it was me." And some days it does. It gets overwhelming where you're like, I have cancer. I take care of cancer patients. I got these kids. I got to go to
Yep.
sports to do
Yep.
lot the grocery shopping, and I got to find time to exercise and do all this stuff.
Your resilience shone through, right? And I think that in the face of adversity and challenging things like a cancer diagnosis or any kind of difficult health diagnosis, particularly, right? That
Mhm.
forces you to take a step back, maybe from work for a bit, or maybe you can't be as present with family as you want to be because you do have to take care of
Right.
yourself. I think even in those really tough moments, we can pull, okay, what matters? And how is this going to change my life going forward, and how can
Mhm.
I make it better?
Absolutely.
What is your biggest takeaway from this whole experience?
Uh, so my biggest takeaway, if for well, to break it down into like relationships, family, is just being 100% present and
Mhm.
just really seeing the most beautiful moments in just the ordinary days. So that's
The
number
mundane.
one. The Monday that is to me, for my family and my relationships, learning to say no to stuff, setting
Okay.
boundaries. I
Okay.
was, well, the old Laura would have done that. No, the new Laura's not doing that. uh, though Laura would do this and that and this and that. And I think, yeah, that's what got me into trouble. So, this Laura is gonna slow down. As far
Yeah.
as career, in my professional life, I use this as a way, and I mean, now that I'm been more public about my diagnosis, more people know about it, right?
Mhm.
But even when people didn't know about it, for me, it's still just sitting down with the patient and really getting to know them.
Mhm.
By the nature of what I'm doing, I have to get to know people pretty quickly, pretty
Mhm.
short period of time. So I think
Yep.
that vulnerability and being able to share my story and or put myself in their shoes can create an immediate connection with people that
Mhm.
we can share on a level where I can heal. Right. That's really
Yep.
the ultimate goal is like maybe I can't fix your cancer, but what can I do to heal you today? Like, how can I help in a way that even if it's not being the cancer doctor or giving them chemotherapy? And even just the other day, I prayed with a patient, right?
Mhm.
Like
Yep.
that's,
Just being present.
I said, I don't know what, and we had a connection prior, so we known each other similar. Like if you were to walk in my office or something like
Mhm.
that, and
Mhm.
I was able to really talk to her on a personal level, and I said, I can only offer you a prayer right now." And I'm like, "Is that appropriate?" I don't and
It's
she
okay.
said,
Yeah.
"Yes." And so that's what I did, and that was that's how I helped that patient that day. And I walked away, and it was a really tough day, and I got really emotional afterwards, but at the end of the day, I was like, this is part
Yep.
of the whole thing. So my
Yep.
takeaway is to be able to share myself with whatever moment I'm in with whoever I'm with, right? So whether it's at
Mhm.
work, with my kids, with my family, with my
Mhm.
friends, strangers, opening myself up to do stuff like this with you. I would have never done stuff like this before. This- I
I have often said that. If 20 years ago you told me I'd be doing this, I would have told you you're crazy.
yeah,
But here we are.
right. So sharing, and I know there's more. There's more to the story. More is and it's unwritten. Like I don't
Mhm.
even know what it's gonna be. And so
Yeah.
I'm just going to take this and I'm gonna try to be an advocate for breast
Mhm.
cancer and screening and be a support for my patients and be there for my family. And the biggest thing is to not do it at the cost of my health. So I have to set boundaries. So those are the
Yep.
things I've kind of learned
On
in
the
the last
way.
year
Yeah.
and a half.
Yeah. I think that vulnerability component is there's just so much to it because in a nutshell, I feel like a little bit of that is like I need to be vulnerable with people with this. Like you said, let people in, share. I think so much about life is connection, and sometimes that is going to be with a stranger. Sometimes that is going to be a small moment of just making a really difficult situation just a little bit gentler.
Yeah, right. I can't
Soften the blow a little.
think about the guy who gave me the high five. I
I
just
love it.
I love
Yeah.
it. I'm like, if I didn't share my story, I would have been a ball of nerves, walked into this, nobody would have known hide nor hair. And here I am, I
Mhm.
get this high five and I'm like, I can do this.
And he bumped it down a little bit for
Yeah.
you. Just that moment eased you a little bit of
Yeah.
just
It
like,
would
"Okay, yeah, I got this."
right.
Yeah.
So there's nothing you can't do. And my record for making it through hard days, as is yours, is 100%. We're still here. We gotta keep going. I love that meme that pops up on Instagram. It's one of my favorite, right? It's like,
Yep,
well, I'm at
yep,
100% making it through the most terrible days, and you just gotta keep moving forward. And
yep.
I was saying that during I get with my meditation these mantras and stuff, and mine was the only path is forward, right? When
Yeah,
I had
literally.
I told the breast surgeon or the and my plastic surgeon, I said, I am not getting an infected expander. I am not
Yep.
doing any of this. We are
Yep.
not going back. We're going forward. And I
And you
was like,
did. And you did all of that.
yeah, yeah. So, and I know not as many people, not as many patients have. For me, I had minimal complications. Yes, I have pain. Yes, I'm uncomfortable. I'm not going to sugarcoat it. Yes, mentally, I've been through, I feel like a war. But on the other end of it, you're going to find yourself in a way that you've never seen yourself. And some days I'm very proud of myself, and some days I'm exhausted.
And
And
that's
that's
okay.
just
I think that's life. I think that's
yeah,
life.
and some days it's some days you can be really sad and you lean into all those kind of techniques to lift your spirit.
Yep. Embrace the hard moments, teach us a lot about ourselves. They teach us a lot about others. And it's I'm grateful for your vulnerability, for your choice to share your story and to join me for this recording.
Thank you. Thanks for
I
having
think people are
I'm
gonna love it.
oh, hopefully I'm new to this. I'm getting much more comfortable with my face and my voice and
And it's
getting
so funny in the beginning, like, I was like, "Ooh, I don't like this or like that." Now I'm just kinda like, "Eh, whatever. I'm here in my T-shirt, got my leggings on, like, I'm not coming on fancy," like and honestly, nobody cares. They care about the content. People will reach out and say, "Oh my gosh, I love this." You're probably gonna hear people, "Oh my gosh, I heard this and or I saw this." It's great.
if
So,
and I told my husband, it's some people always wonder what your intentions are and this and that. And I told him, I said, if my telling my story, it's not about I don't care if people know who I am or not. I go, my story, if it gets one person to go get their mammogram, and I can tell you how many texts I've gotten since sharing my story of people, somebody who's like, I
a
scheduled
lot.
my mammogram today. And those
Yep,
are my favorite texts. I love
yep,
it. It makes me so
yep.
happy when somebody's like, I went and did this today. And I think to myself, okay, all right, we're making some
My job
headway.
is done. You can go through this really difficult experience and good things can come out of it. You're paying it forward. You're trying to put it out there into the world and maybe help somebody else catch it early, help somebody else
Right.
prevent this from happening. It makes a difference.
Yeah,
So, and it does.
that's the goal.
So thank you.
Thank you. Thank you so much. Oh, you're wonderful. This was so
Thank you. So are you. Yeah, this was great. I love it. This is going to be a great episode. So thank
all
you so
right.
much for being
I'm gonna
here. We'll
get off
talk
before
soon.
all of a sudden those kids come barreling through the door. They're about
Yes,
to
they
any
do.
minute.
All right. Have a good day.
Bye.
Bye.
Thanks, Mindy.
Thank you for joining me for today's conversation on the Unapologetic Midlife Podcast. If this episode spoke to you, please take a moment to subscribe, rate, and leave a review. It helps others find this space of honesty, hope, and reinvention. The Unapologetic Midlife Podcast is for educational and informational purposes only and is not intended as medical, mental health, or professional advice. Listening to this podcast does not create a therapeutic relationship with Mindi Lobuzzetta, LMHC. Always consult with a qualified healthcare or mental health professional regarding your individual needs. If you are experiencing a crisis, call 911 or dial 988 for the Suicide Crisis Lifeline. Hope to see you soon.